We are now ready to consider the various positioning factors of the patient. Various terms are commonly used to describe the position of the animal. You should initially be familiar with the following terms: right and left lateral recumbent views, ventrodorsal views, and dorsoventral views. We will now illustrate each of these positions. A right lateral radiograph is taken with the animal lying on its right side. The radiograph is marked with an R to denote the animal's right side is closest to the film. It is important that the animal in lateral recumbency is lying parallel with the table when the exposure is made. This may require adjusting the animal's position so that the dog or cat is not angled. A left lateral radiograph is taken with the animal lying on its left side. In similar fashion, an L is used to mark the film. In most situations, we will be taking two pictures to give the veterinarian reading the films a sense of depth perception. The additional view that will complement the lateral view can be either a VD or a DV. The VD view stands for ventral dorsal. With this view, the animal is lying on its back. The X-ray beam will first penetrate the underside of the animal, or its ventral surface, and exit through the animal's back, or dorsal surface. The R will identify the animal's right side. Once again, the animal should be positioned as straight and upright as possible. A DV view would mean the dog would be positioned so that the beam would initially enter the back and exit through the underside. Other positions are used, but the lateral and the VD are the most commonly encountered views. The two views we just discussed can sometimes be taken on the same film when radiographing a relatively small animal. By narrowing the collimator and using an appropriate-sized lead shield, two tabletop exposures can be grouped onto one film for greater cost-effectiveness. There are several operating procedures you should follow prior to exposing the film. First, be sure everyone has left the area except those properly protected behind lead aprons or walls. Second, always keep your hand and other body parts out of the immediate beam and keep the collimated beam limited to the smallest possible area. With the patient being held as still as possible, expose the film by pressing the exposure button or foot pedal. Most foot pedals are two-stage switches. The first depression or partial depression activates the rotor. You'll hear a motor running in the tube in this prep stage. A second depression of the pedal will actually create the exposure. The actual exposure is generally indicated by a tone or beep. The cassette should then be removed from the room and replaced with a new cassette when a second film is needed. The settings on the machine will often have to be adjusted to different thicknesses prior to this second exposure. Because animals are not as cooperative as their human counterparts, it may be necessary to sedate or anesthetize a more active patient. Unless the time of exposure is less than 1/20th of a second, movement will result in a blurred radiograph. When taking chest radiographs, always expose the film on inspiration or when the animal's lungs are full of air. Having the lungs full of air will increase the contrast and make chest films much easier to read. When radiographing the abdomen or skeleton, the exposure should be on expiration. The pause between breaths will produce less motion and a better image. Another helpful hint when X-raying legs and paws is to extend the leg with a thin rope or gauze, thus keeping your hands out of the beam. Once the film has been exposed, it is now time to develop it. Proper developing technique is just as important as proper X-ray machine technique in achieving quality films. Because X-ray film is very sensitive to room light, the handling and developing of this film must be done in a dark room. A special red light, called a safe light, is often used to allow the person developing the films some light in order to see what they're doing. This particular red light is not picked up by the X-ray film, making it safe in the presence of film. Absolutely no white light, however, should be visible in the dark room when developing films. Special care should be taken to prevent unaware colleagues from bursting into the room during the developing process. There are two techniques for developing X-ray films: manual processing and the use of an automatic processor. We'll begin with the manual method. When manually developing X-ray films, there are three tanks that we will utilize: a developing tank, a rinsing tank, and a fixing tank. Both the developing and fixing tanks should be stirred prior to use each time. The rinsing tank should be turned on so water will slowly circulate. The temperature of these tanks is important and should be evaluated prior to turning out the lights. This temperature will determine how long the film will take to develop. With only the safe light on and with hands clean and dry, we are now ready to begin. The cassette is opened and the film is carefully removed from the cassette, handling it only by its corners. It is loaded into a film rack by attaching a clip to each corner of the film. The clips at the bottom of the rack should be attached first, allowing the top clips to stretch the film with their spring-like action. The film rack is then placed into the developing tank. When placing the film into the developer, gently agitate the film for 10 seconds to help release any air bubbles on the surface of the film. The tank should then be covered for approximately 5 minutes. This time is adjusted up if the temperature is below 68 degrees and adjusted down if the water temperature is above 68 degrees. There should be a time temperature chart like that in your notes in the darkroom. After this time has elapsed, remove the film from the developer and immediately rinse it in the center water tank. Developer that drips from the film should not go back into the developer, as this developer solution is probably already used up. Agitate the film in the rinse water for 15 to 20 seconds, then place the film into the fixer. This solution is designed to stop the developing process and prevent additional film changes. The film should be left in the fixer for approximately 10 minutes, or twice as long as it remained in the developer. It can be removed and evaluated for brief periods of time after it has been fixed for at least 2 to 3 minutes. Light will have little, if any, influence on the film by this time. Once the film has been properly fixed, it is returned to the rinse area, where it should remain for 20 minutes, or at least twice as long as it was in the fixer. Don't leave the films in this rinse too long, as the film may eventually dissolve. The rinsing process assures that all the chemicals are thoroughly removed from the film prior to drying. The film is then removed and hung on a rack for drying. Special film dryers are also used that circulate warm air, speeding the drying process. More than one film can be manually developed at any given time, but special attention should be paid so that the films or their racks do not come in contact with each other in the tanks. This inevitably leads to scratches or undeveloped areas on the films. While the films are developing is an excellent time to reload the cassette for its next use. With clean, dry hands, carefully remove a piece of appropriately sized X-ray film from a light-proof box. After removing a sheet of film and placing it squarely into the cassette, you should quickly close the box to prevent light from ruining hundreds of dollars in X-ray film. These boxes are sometimes kept in light-proof film bins to assure that light does not damage the film. Automatic processors are a faster, easier method of developing X-ray films in practices that develop enough films to justify their additional expense. These automated machines develop the film with the use of developers, fixers, and rinses just as in manual processing, but the process is automated and sped up by using special developers and fixers at higher temperatures. Automatic processors will require a bit more maintenance, but they produce a fully developed, dry X-ray film in 1 to 4 minutes. There are many different processors on the market, but most require simply inserting the film at one end. Many processors will require the operator to pass 1 or 2 dummy films through the processor after it is warmed up. With both manual and automatic processing, it will be necessary to change the chemicals on a regular basis, usually every 6 to 8 weeks. Replenishing fluids may need to be added to the tanks on a daily or weekly basis, depending on the number of films being processed. Fluid maintenance and cleaning protocols on automatic processors will be determined by the manufacturer. Once the films are developed and dried, they are ready to be read by a veterinarian on a lighted view box. Radiology has allowed veterinarians to see within the body and diagnose conditions such as bone fractures, heart disease, foreign objects in the digestive tract, and much, much more. Proper storage of X-ray films involves storing them in properly labeled paper sleeves. They can then be filed by the owner's last name, an assigned ID number, or by the date they were taken. The fascinating world of radiology can be a very safe and rewarding experience if you act upon the fundamentals you've learned in this program.